All right, today we're tackling a choice that many of us might face, but honestly, very few of us are ever really prepared for. Wheelchair versus gurney transport. It sounds pretty simple on the surface, right? But getting this right is absolutely crucial for the safety and comfort of someone you care about.
So picture this. A loved one needs to get to a doctor's appointment, but a regular car just isn't going to work. That moment can be really stressful, and suddenly you're faced with a bunch of confusing options. Our goal today is super simple, to give you a clear, easy-to-follow guide so you can make the absolute safest decision with total confidence. You know, when it comes to non-emergency medical transport, you've basically got two main paths to choose from. But this isn't a one-size-fits-all kind of deal. The right choice really just boils down to one thing: the specific medical and safety needs of the person who's traveling. Okay. First up, let's talk about the one most people probably think of: wheelchair service. The big make-or-break question here is pretty straightforward. Can the person sit upright, comfortably and safely for the entire duration of the trip? Let's dig into what that really means.
That phrase right there, safely remain seated, is everything. This is about way more than just being able to sit in a chair for a few moments. We're talking about having enough core and upper body strength to be stable and secure through the whole journey, from the moment they're picked up to the moment they're dropped off.
So, who's the perfect candidate for this? Well, think about someone who already uses a wheelchair. Or maybe it's for regular trips to a doctor's office, or for 8-patient treatments like dialysis or physical therapy. It's also a really common choice for people being discharged from a hospital, but only if they've been medically cleared to travel sitting up.
And listen, these vehicles are built specifically for this. You're not just rolling a wheelchair into the back of a regular van. No way. These have hydraulic lifts or sturdy ramps for super easy entry. They've got specialized restraint systems that literally lock the wheelchair into place, and the drivers are trained to help passengers get in and out safely. It's a whole system designed around secure, seated travel.
Now, let's shift gears to our second option, gurney service. And it's important to know, this isn't just another choice. It's designed for a completely different set of medical needs, one where lying down isn't just for comfort, it's an absolute requirement.
Gurney transport, which you'll also hear called stretcher transport, is for patients who must without a doubt stay completely horizontal. This could be because of an injury, maybe they're recovering from surgery, or they have a medical condition that makes sitting up unsafe, or maybe even impossible.
This service is so critical for anyone who is bedridden. Or think about someone with an injury, like a hip fracture, that makes sitting physically impossible. For that person, putting them in a wheelchair isn't just uncomfortable, it could actually be dangerous. Gurney transport gives them the stability they need.
And this is where you really see that next level of medical care. The vehicles have a proper medical-grade stretcher that's secured with a whole system of safety straps. Plus, the staff are specially trained in how to safely lift and transfer a patient from their bed onto the gurney and back again. It's a much more involved process.
Okay, so we've looked at both options on their own. Now, let's put them side by side to really drive home what sets them apart. I think this is where the right choice becomes crystal clear.
You know, when you strip everything else away, the decision boils down to this one simple, powerful factor: the passenger's physical position. Can they sit up or must they lie down? Every other detail we've talked about really just flows from that single question.
Let's just walk through this chart because it lays it all out. Look at staff assistance. With wheelchair transport, it's general help. With a gurney, it's specialized lifting and even monitoring. The vehicles themselves are totally different. And the best use case? It's pretty obvious. Wheelchair service is perfect for those routine visits, while gurney service is essential for anyone who is bedridden or medically fragile and has to stay flat.
So, now you've got all the information, but how do you actually apply it when you're in the middle of a potentially stressful situation? Well, here is a super straightforward framework to help guide you.
It's really just a simple 3-step process. First, be totally honest when you assess their mobility, not just for a minute, but for the whole ride. Second, what are their specific medical needs? Is a doctor ordering them to stay flat? And third, and this is the most important one, always prioritize safety. If you are ever in doubt, choosing the more supportive option, which is gurney transport, is always the right call.
Let's just pause on this for a second, because this is the big takeaway. The decision is not about convenience, it's not about cost, it is fundamentally 100% about the patient's medical condition and their physical ability to sit up. That is the only thing that should guide this choice. At the end of the day, understanding this difference isn't just some random piece of trivia. It has a direct, real-world impact on the safety and the well-being of the person you're trying to help. It's what ensures they get where they're going without any unnecessary risk or discomfort. So, we'll leave you with this question to think about.
I know it's not something anyone really wants to plan for, but just having this knowledge in your back pocket can completely transform a moment of crisis into a calm, managed process. So ask yourself, are you prepared?